I want all my dear students to come and join and avail our classes so that you will also have a very good score when it comes to your OET. Okay, so you can fly to your dream destinations by clearing occupational English test. So I welcome all of you, and I want all my dear students, those who are watching me, please do comment, please do subscribe, please do share it with whom are in need, okay, of these classes. Fine. Okay, now it's time for discuss the questions that will be displayed right there. Okay, yes, the question can be displayed there. Mute, mute ചെയ്ത് ഇതിനകത്ത് വരുന്നില്ലല്ലോ ക്ലാസ് അല്ല പഴയത് തന്നെ വരുന്നത് ക്വസ്റ്റ്യൻ ഡിസ്പ്ലേ ആയി കിടക്കില്ലേ അവനെ Okay, the question is displayed right there. So now we'll have a discussion on this question. Okay, all of you, yes, those who are watching me, any sort of doubts or queries means you can throw it to me. Yes, yes, setting is a clinic. Your patient is 50-year-old and has had a lesion removed from his or her hand following a diagnosis of squamous cell carcinoma. Was overexposed to sun in teens. You have come to remove the stitches. Confirm the reason for the visit. That means in bracket it is given like removal of stitches, wound cleaning, redressing. Okay. Find out if the patient has any concerns. So this particular topic, yes, it is given in a clinic setting. 51-year-old patient. Squamous cell carcinoma was the diagnosis. Lesion was removed. Okay. Overexposure, a background information is given there. So you'll be having confusion, but these also useful during our communication. Okay, background information is given like overexposure to sun in teens, and now it is our duty to remove the stitches. Confirm the so our role is to remove the stitch, confirm the reason for the visit. So we need to confirm. We can collect the name and confirm. Are you Mr. So and so for removal of stitches? So likewise, you can start the topic. Take the name, confirm the reason for the visit. You can take like that. All my dear students, take the name, confirm reason for the visit. That means the patient is here for suture removal and redressing. So we can take the name and can confirm their purpose for visit. Take the name, confirm the purpose for visit. Okay, and find out if the patient has any concerns. The question is quite bulky. That is quite heavy. You may think. But in these sort of questions, you should learn how to organize the task. Never go for any frequent further elaborations. Just take the task, touch each and every one, just give the points, and if you finally if you feel like the time is left more left, you can just add some points of your own. So these are very bulky tasks, these are very heavy tasks that could you may find it difficult to cope with time. So all my dear students, make sure that you're just organizing these topics properly, otherwise that won't be there in our time limit. Okay, fine. Give information about squamous cell carcinoma. So they would be having some concern regarding squamous cell carcinoma. We need to give information. That means it is a type of skin cancer, treatment options available, surgery, etc. So this patient surgery is over, lesion has been removed. Okay, now suture removal. Reassure the patient about the surgery. So we need to reassuringly answer to the questions. Lesion is removed, surgery is over. So we need to reassure the patient. Lesion removed, cancer unlikely to spread. We have to inform that. Stress the importance of patient skin monitoring. Even if the skin lesion has been removed, we should ask the patient to go for frequent skin monitoring. Okay. Yes. Next, resist the request for importance of skin monitoring. What are all the things they should monitor? Check for new or changing spots, regular GP checkup everything. We should inform the patient. Resist the request for information about further surgery. So they would be asking the possibility of further surgery in future. We should politely resist that because that's not in our hands. We need to relate to the doctor's decision. Okay. Advise the patient with doctor. Find out the patient's habit when in sun. So we need to ask some details about skincare while in sun. Okay, how the patient used to take care of their skin, how the patient care his or her skin while in sun. Okay, so whether they using sunscreen hats or something. Confirm some damage is historical. Okay, so my dear students, confirm some damages historical. That means that would be that could create some sort of confusion. Confirm some damages historical. So you can relate it with the information which is given over exposure to sun during teens. That means the patient would be nowadays very careful. They will be caring their skin very much, and they would be surprised hearing that sun exposure can cause skin cancer. But we need to tell that it is not because of day-to-day exposure. This would have already happened in the past. This would have already happened in the past because see the supporting information is given there over exposure to sun in teens. Okay, so that is how you should confirm. Okay, that is how you should relate. Historical in the sense it is because of previous exposure, teenage exposure. Now the patient is 51 years old now, so teenage means you know that. Okay. So during teens, historical damage means this skin cancer has happened because of previous historical exposure, past exposure. Okay. That's how you should deal with. Fine. Advise the patient to continue covering up in the sun. So we can ask them to continue their covering up in sun to prevent further damage. Find out patient's wound surgeries. We need to ask about the lesion, that lesion removed wound, no? Post surgery, any pain or discharge, we should ask. Next, give reasons for removal of stitches now. So the patient would be questioning the lesion removal, suture removal. So we need to tell that this. We should give the reason. That means wound healing has occurred. Assessed by the doctor, it is fit. Typically removed within 7 to 40 days. So we should remove that. This is the correct time for removal. The patient would be uh, to continue it for few more days, but we have to tell that everything is in proper, so it's right time to remove the sutures. Fine. Advice on aftercare. So after lesion suture removal, how to take care, keep the wound clean, covered and dry, establish the patient consent to have the stitches removed. So finally, the conversation fixing a consent for suture removal, lesion or stitch removal. That's all regarding the topic. Okay. So my dear students, hope the question is clear to all my dear students. Those who all are there. Okay, hi Manna. Hello, Mane. So those who are watching me, hello. Yes, we had a celebration last week. It was a part of our so such a sort of massive result we have got last time. That was a recordical results in this our province itself. Okay, so we are very proud, and I would like to introduce all those things to my dear students so that you can come and get our services. We are ready to serve you with all sorts of education materials for your occupational English test, for cracking your occupational English test. Okay, yes. So I think the question is clear to all my dear students. Any queries or concerns means you can come to us. You can just throw me the questions. You can put your suggestions in the comment box. Okay. Yes. Yes, Maglai. So if you all are okay means if there are no concerns means let me start. I'll continue with this discussion session. Fine. Okay. So I told you you can collect the name and can confirm the purpose of the visit. Suppose we can take the patient's name as what? Um, Albert. We can take it as Albert. Okay. Yes. Right. So let us start. We can start. All are ready. Yes, my dear students. Okay. So I'm going to start the topic. So we are taking the name. We are confirming the reasons. Good morning. Good morning. Please come in. Have your seat. It's a clinic. We are welcoming the patient. Good morning. So for the first task, I want all of you to focus on the first task. Good morning. Good morning. Please come in. Have your seat. My name is Abhilash. I'm the nurse working here in this clinic. I'm the nurse in this clinic. I'm the nurse working in this clinic. Am I right in thinking that? Am I right in thinking that you're Mr. Albert for suture removal? Okay. following the lesion surgery? Yes. Okay. Am I right in thinking that you're Mr. Albert for suture removal, following lesion surgery, following the surgery? Am I right in thinking that you're here for suture removal? So the patient would be saying like, yes, nurse, I'm here for suture removal. I'm here for suture removal. Yeah, right. Okay. Pleasure meeting you, Albert. Okay. How are you doing? Hope everything is going on well. We will soon remove the suture. Okay. We will soon remove the suture and we'll continue with wound cleansing and redressing. Okay. We'll soon remove the stitches and continue with wound cleansing and redressing. Okay. So pleasure meeting you, Mr. Albert. Yes, how's the thing? So we will remove the stitch and okay, so we will remove the stitch and continue with wound cleansing and redressing. Okay, wound cleansing and redressing. I hope you're okay. I hope you're okay. Any other concerns or any other queries? Anything is bothering you? Okay, so this is how we are just beginning the topic, that general inquiry with the patient we are doing. Yes, my dear students. So the task is clear. Then the patient will be asking like, oh nurse, I'm really very worried about my health situation, squamous cell carcinoma and all doctor was telling me. How could quite concerned. Okay, so we need to inform the patient. Yes, Albert, what you have heard is true. Yes, Albert, what you have heard is true. Okay, yours is a squamous cell carcinoma. Okay, yours is a squamous cell carcinoma. What you have heard is true. It is squamous cell carcinoma. Okay, it's a type of skin cancer. It is a type of skin cancer which can be aggressive. It is a type of skin cancer which can be aggressive but not life threatening. Okay, which can, it's a type of, yeah, what you have heard. Yes, Albert, what you have heard is true. It is squamous cell carcinoma, which can be aggressive. It is a type of skin cancer which can be aggressive, but not life threatening. No life threatening. Okay, and for you, the treatment we have done with the treatment. Okay, okay, and we have done with the treatment. The surgery is over. Okay, the surgery has been done for you. The surgery is over. Okay, there are treatment. It is treatable. It is treatable. It is manageable. Different options are available. Surgery is the definitive option. Okay, surgery is definitive management, and we are done with that. Your surgery is over. Okay, your surgery is over. You don't have, okay, so so the patient, yes, nurse, my surgery. Yes, you don't have to worry about. You don't have to worry about. The surgery is over, lesion has been removed. Okay, the surgery is over, lesion has been removed. The cancer is unlikely to spread. Okay, the surgery is over, lesion has been removed. So the cancer is unlikely to spread. Okay, we can arrest the progress of cancer spreading. We can arrest the progress of cancer spreading. Okay, you are safe. You are safe. You are safe. Okay. So the patient would, oh, thank you, nurse. But even if the surgery is over, I would like you to have a close watch over your skin. Even if the surgery is over, what I would like you to do is to have a close watch over the skin. Even if the surgery is over, I want you to frequently monitor skin. Or what I would like you to do is to have a close watch over the skin. Do monitor the skin carefully. Do monitor the skin carefully. Okay, I want you to assess the skin area, the surgical area, the lesion removed area. Okay, I want you to examine the lesion area, the wound, even observe your skin for any other changing molds, spots, or warts. WARTS. Okay, I want you to frequently monitor your skin for any new changing spots, molds, MOLES, molds, or warts. WARTS, warts. Okay, yes, just see for that. Okay, and in case if you observe something unusual, and in case if you observe something unusual, and in case if you observe something unusual, get back to the general practitioner immediately. Get back to the general practitioner immediately. Okay, get back to the general practitioner immediately. Get back to the general practitioner immediately. Okay, this is how we are going to inform the patient. Okay, so the patient would be saying like, sure, nurse, I will take care of that. Nurse, I'm likely to develop more surgeries in my in future? Am I at risk for having more surgeries? I really have a doubt. So the patient is asking about the possibility of further surgeries. We have politely. I'm really very sorry, Albert. I'm really very sorry. I cannot tell you that for sure. Okay. Okay. I'm really very sorry. I cannot tell you that for sure. Okay. You can have a chat with the doctor. You can have a chat with the doctor. They will let you know more about it. You can have a chat with the doctor. They will let you know more about it. But one thing is certain, now you are safe since the surgery is over and the treatment is in progress. Okay. But one thing is certain that you are safe, your surgery is over and the treatment is in progress. Okay. Fine. So the patient would be agreeing to that. Oh, Nas, I understand. I understand. Okay, shall we discuss something about your skincare habits? Okay. Okay, shall we discuss something about your skincare habits? Okay, shall we discuss something about your skincare habits? Do you frequently get exposed to a sun? Okay, do you have frequent exposure towards sun? Do you get frequently exposed towards sun? Do you get frequently exposed towards sun? Okay. So one by one we are asking the question. How do you usually care your skin while in sun? Okay. How do you usually care your skin while in sun? Suji, how do you usually care your skin while in sun? Okay. Do you use sunscreen lotion, hats, or other protective clothing? Do you use sunscreen lotion, hats, or other protective clothing? Do you have sun exposure in the past? What about your sun exposure in past? Okay. Do you have any history of past sun exposure? Or did you have frequent exposure to sun in the past? Okay, all those things we are just asking. So the patient is telling like during teens, I used to get exposure to, got much exposure to sun, but now I'm very careful. I'm doing all those things. I'm wearing sunscreen lotion. I don't know how this has happened now. So I'm really very worried about all those things. So now there we need to make sure that this damage is historical. Yes, that could be the reason. Yes, that could be the reason. Okay, this damage would have already happened in the past. Yes, that could be the reason. This damage would have already happened in the past. It is not because of day-to-day exposure. This is because of previous exposure. This is because of previous exposure. Some damage can be historical, Albert. Some damage can be historical, Albert. Okay, so they will be saying like, but now what you're doing is really commendable. So but now, what you're doing is really commendable. I mean, your skincare habits. Please do continue using sunscreen, lotion, hats, and other protective things. But now, what you're doing is really commendable. Okay, but now what you're doing is really commendable. I mean, your skincare habits. Okay, please do continue using hats, sunscreen, lotions, protective clothing, and or while in sun. Please do that. Take care of that. Do take care of that. Do take care of that. This is how we are going to get the patient cleansed. Okay, are you getting me, my dear students? Yes. Okay, so if you do all these things, you can prevent further skin damage. If you do all these things, we can prevent the risk of further skin complications and damage. If you do this, we can prevent further complications and other skin damage. Are you getting me? Please to continue that. So the patient will be agreeing to that. Yes. Okay, now tell me about your wound. How do you feel since surgery? Okay, now you tell me about your wound. How do you feel since surgery? Can I have a quick look and assessment? Is there any pain or discharge? So this is how we are going to. Fine. Now tell me about your wound. How do you feel since surgery? Okay. Shall I have a quick look and assessment? Is there any pain or other discharge? Is there a pain, discomfort, or discharge? Okay, is there any pain, discomfort, or is there any pain, discharge, or any other discomfort? Is there any pain, discharge, or discomfort? This is how we are going to. So patient will be saying like, no, no, everything is okay. I'm doing well. There is nothing unusual. There is nothing unpleasant. But I want to ask you one thing: why this is getting removed? I feel like this is a premature release of suture. I feel like this is a premature release of. It should have been there in position for a few more days, no, no. So the patient is expressing their concern. Okay. So what we, I understand. I know why you're feeling this way. The last task. I understand. I know why you're feeling this. See, Albert, your wound has healed properly. See, Albert, your wound has healed properly. Okay, wound. Okay, okay, your wound has healed properly. It's healthy. Your wound has healed properly. It is healthy. Okay, this has been carefully assessed by the doctor. This has been carefully assessed by the doctor. This has been carefully assessed by the doctor. Okay, there is nothing to be overly concerned about. There is nothing to be overly concerned about. It is usual to remove it between 7 to 14 days, and it is usual to remove between 7 to 14 days. Delay in release could make the suture site more harder and it may hurt your appeal. Delay in suture removal can make the suture site harder and it can hurt your appeal. It can hurt your appeal. Okay, so now it is safe, you are safe, and it is right time to remove the suture. Now you are safe, everything is okay, everything is well, everything is okay, and it's right time to remove the sutures. It is right time to remove the stitches. Right, so this is how we are getting. Yeah. Because the patient will be saying, like, oh, nurse, I don't want all those things. You can remove the sutures. And even after the suture removal, please do take care of wound. Even after the suture gets removed, please do take care of wound. Keep the skin area clean, dry, and well covered. Keep the skin area, keep the wound area clean, dry, and well covered. Keep the wound area, keep the skin area clean, dry, and well covered. Okay. So after a few days, you can remove that and proper healing will take place. After a few days, you can remove that so that proper healing takes place. Okay, so this is how we are just making the patient. Are you getting me? Are you getting me? Any other queries for me? Okay, are you getting me? Any other queries for me? Okay, are you getting me? Any other queries for me? So the patient will be saying like, no, nurse, I'm comfortable, I'm okay. Uh, so you can okay, the patient will be agreeing with this. Okay, I'm happy that you are confident. I'm happy that you're confident now. Okay, then shall I proceed with the suture removal? Okay, then shall I proceed with the suture removal? Okay, then shall I proceed with the suture removal? Okay, okay, then shall I proceed with the future removal? Okay, okay, then shall I proceed with suture removal? Are you ready? So the consent, in the sense, there is no need of any written consent, because this is only a minor procedure. Not at all invasive procedure. Okay, it is a it is a non-invasive procedure, so there is no need of getting some written consent. So oral consent you can take, verbal consent you can take. Okay, okay, I'm happy that you are confident. Okay, well then shall I proceed with the suture removal? Are you ready? Are you okay? So the patient is saying like, okay, nurse, I'm ready. Glad that you agree. So finally, I'm just glad that you agree. Now you may come with me. Now you please come with me. Let's have the sutures removed. Let's have the sutures removed. Let's remove the sutures. Okay. I'm glad that you agree. Glad that you agree. Okay. Glad that you agree. Now you may come with me. Now you may come with me. Let's have the sutures. Let's have the sutures removed. Let's have the sutures removed. That we are going to the procedure rooms. By that we are finishing that. No need of any other. Oh, bless, all the best. Good night, good morning. Nothing should be there. Glad that you agree. And you may come with me. Let's have the sutures removed. By that, you should end up the conversation. So that's all regarding the topic. Hope the situation was clear to all my dear students. So this is how you can organize heavy tasks, bulky tasks, multitask questions. Okay, so these all are exam related topics. I want all my dear students to work with this topic. Set the timer on, sit in front of a mirror, put the timer on, put the recorder on. By the recorder, you can just have your voice analyzed, voice culture you can develop. Okay, and through mirror you can just give some actions and reactions, so that natural display of dialogue is possible. And through recorder, if you hear that, you will be able to assess your tone and your ability, okay, your voice ability. You'll be able to, you can modify your way of talking and all. Okay, so these are the way by which you can improvise yourself. Just do that. In case of any queries or concerns, log into us, get us those suggestions, get us those comments, so we'll be able to, will be able to solve that, and we are all time ready to serve you. Our best teams are here to help you all, my dear students. So see you all on next Friday for our 35th live session. Till then, take care. Bye.